is most definitely easier to start with IUI. First of all, it is an office procedure. You have to come to the hospital for a couple of hours at the most. There are no painful injections. So IUI, at least as an initial procedure, definitely 100% we should do IUI rather than this new trend of offering IVF for everybody and skipping this step completely of offering IVF. And it's not just one or two IUI. You should give them a fair chance. Do it 3 or 4 times before you give up on them. Just because you do one IUI, it's not going. It might or might not be successful. Do it 3 or 4 times, then definitely they have a better chance of getting a successful result and a pregnancy.
When we talk about infertility treatment, a lot of people across India, I guess, we only automatically think of IVF. But IVF is very stressful in the soul, in the spirit, emotionally and financially. And for the body also. Isn't it easier to start with IUI? There are multiple benefits.
Madam, it is most definitely easier to start with IUI. First of all, it is an office procedure. You have to come to the hospital for a couple of hours at the most. There are no painful injections, or you don't have to get admitted. No injection, no saline. Just after the IUI procedure, you have to sleep for a couple of hours. The moment you go home, you can resume your normal duties. And plus, you don't have to travel anywhere. Expenses, of course, definitely it's around 10% of or less than IVF. Less than 10% of what IVF costs. The expense is definitely less. So IUI, at least as an initial procedure, definitely 100% we should do IUI. Rather than this new trend of offering IVF for everybody and skipping this step completely, which we often see what happens. So I think definitely IUI, and it's not just one or two IUI. You should give them a fair chance. Do it 3 or 4 times before you give up on them. So just because you do one IUI, it's not going. It might or might not be successful. If you do it 3 or 4 times, then definitely they have a better chance of getting a successful result and a pregnancy.
Coming to the point, because I see that a lot of people, when they do IUI, they do it for one round, second round at the max, and then they say, "Oh, we're going to start doing IVF." And
yes, absolutely,
not giving enough chance. So with so much of success seen using Androwash by Subhag, what do you think of the Androwash machine?
Madam, I think it's a brilliant innovation because for the first few cycles, myself, my OT technician, my lab technician, and my general manager, all 4 of us used to be standing there and we used to read the instructions and then change the pipette, change the test tube. Now I don't even have to go. My OT assistant does it better than me and faster than me. And he has the steps learned all by heart. So basically, it is a very simple procedure. Once you start doing it, then you and your staff can easily pick it up very quickly and keep continuing doing it.
And that's how it's designed to be used by any lay person. Efficient, fast, and user-friendly.
It is very friendly, madam. It's not complicated at all.
Oh, that's wonderful to hear.
Yeah.
What do you think of recommending a home insemination kit to your patients?
A home insemination kit is a good idea, but the patients have to be educated enough and motivated enough. In the select criteria of patients, we can definitely use it.
With careful selection of
the patient, the lady has to be confident herself.
Yeah.
If she's too shy, too diffident, then actually we have tried it, but if the lady is too shy, then she doesn't do it. They prefer to come and do it in the hospital with the doctor. So a specific set of patients where both the husband and wife are educated and they understand the concept and what is to be done, then definitely it is a good idea.
Yes. You know, we've had a lot of success stories among all the KLs. We've had stories from, interior India who have used home insemination kit, We Conceived by Subhag, and have seen success in the first try. And on the other side, we have also had doctors such as yourself who has successfully used the Androwash by Subhag. And do you have any advice for the people trying to conceive watching this YouTube video?
Don't give up, because even if you are doing IUI by Androwash or anybody else, or it's not magic, it's not going to it may or may not happen in the first try. So keep the faith, keep faith in yourself, keep faith in doctors and science, and don't give up very easily. Give it a few chances, and then probably you will have a much better chance of success.
Dr. Darshan, we are so indebted to you. Subhag Health Tech wishes you the best in whatever you do, and you will always be fondly remembered.
Oh, thank you, madam.
Thank you for your time.
Yeah, thank you.